Good day, viewers, and welcome to 30 Minutes, the interactive program of Trust Television. With me today is Dr. Faisal Shuaib, the Executive Secretary of the National Primary Healthcare Development Agency, that is the government parastatal that deals with healthcare at the primary level. He's been a medical doctor, and he's also specialized in public health, getting a PhD in that area. He's worked with the Bill and Melinda Gates Foundation. He's worked with the WHO, the World Health Organization. Indeed, he was the incidence officer of the Ebola outbreak some years back in Nigeria. Dr. Faisal, welcome to this program.
Thank you for having me, Manir.
We are right now in the midst of the big challenge of COVID-19, and we are still in the early stage of getting vaccinated, because we've been told by the WHO and all the health experts that the best way to mitigate the current situation we are faced in, whereby there are always mutations, that is new variants of this particular health challenge coming up, is to vaccinate. Where exactly are we with the vaccination in Nigeria now?
So thank you very much for that question. So in terms of vaccinating Nigerians, we've seen ebbs and flows in terms of the activity. A few months after we started vaccinating Nigerians against COVID-19 in March 2021, we had the challenge of getting vaccines. So vaccines were not widely available. First, most of the developed countries bought the vaccines and hoarded them in their stores. So they bought more than 2-3 times their need. Right? So very few quantities came to Africa and other developing countries. But in the latter half of 2021, we began to get additional vaccines. And this has made it possible for us to increase coverage. But we're at a point where we've only been able to vaccinate right around 10% of the populace with the first dose of the vaccine, and only about 5% have taken both doses. That is still a far cry from where we'd like to be, but given the fact that we did not get vaccines on time, I think we're making progress.
But are we even up to the percentage you are quoting? Because what I've seen of recent was 2%, 3%, 5%, and there's so much resistance to it in addition to the problems you've highlighted initially.
Yes, especially in the last couple of weeks, we've seen a ramping up of vaccination uptake. Towards the end of the year, November, that was sort of the numbers we're looking at. We're still hovering around 2 to 3%. But the Presidential Steering Committee, the Federal Ministry of Health, and the National Primary Healthcare Development Agency actually collaborated to roll out a mass vaccination campaign. This was launched, and what we have seen is a replication of that launch all across the country. We've seen governors take leadership and making sure that there's increased communication, allaying of people's fears around the vaccine, and we begin to see more than a doubling of the vaccination rate. So in the early months of 2021, the daily vaccination rate was around 100,000 per day. But since we launched the mass vaccination campaign, we've doubled that. We're seeing vaccination rates of over 200,000. So we've been able to increase the uptake up to 10% for the first dose, and then about 5% for the second dose.
And are we sure that these vaccines are going into arms and not being thrown away, as was the case with some other vaccinations program earlier in Nigeria?
Yes, absolutely. These vaccines are going into the arms of individuals. We've come a very long way from the polio eradication days when some health workers will pour out the vaccines. This is an injectable vaccine. It is not a liquid vaccine. And then the level of monitoring and supervision is way beyond what it used to be in the past. We have now also moved from a manual recording to an electronic database. So there's a closer monitoring of the vaccines that are being issued, and then we also make sure that we tie in the vaccine doses with the data that is being recorded. You mentioned the issue of vaccine hesitancy. Vaccine hesitancy is a global phenomenon,
yes,
especially because of the social media, right? Right now, anybody can just sit in their living room, overnight become an epidemiologist, and begin to make decisions and develop conspiracy theories about vaccinations.
And what are you doing about it to combat all this hesitancy and all the mass hysteria being created about it, and the fake news as well that has been spread? I mean, remember the early ones that if you get vaccinated, you could die within a year or two.
Right.
Or a chip is injected into your body.
Absolutely. So what we've been doing along with our sister agencies like the National Orientation Agency, the Federal Ministry of Information, is to also put the correct information out there, debunking those misinformation and disinformation, by really demonstrating to Nigerians that it is not true that you will die 2 years after taking the vaccine. Nobody knows when they will die, right? So why would anybody believe that exactly 2 years after you take the vaccine, you will die? And we've seen that, in the course of the vaccination, over, 15 million people have now been vaccinated. 50 million Nigerians cannot be wrong, right? We've not seen these Nigerians just fall like a pack of cats after taking the vaccines. Vaccine hesitancy is a global phenomenon and is the same results that we will see when we use the same approach, which is to make sure that we provide the right information to Nigerians so that they are very clear about what the vaccination process is about and the fact that the data speaks. So right now, over 80% of the people who are dying from COVID-19 are the unvaccinated. So dying from COVID-19 is now a thing of those who have not been vaccinated.
But is the strategy of now forcing literally government workers, office workers to get vaccinated, it is something that will work, especially given the stories we've had of fake vaccination cards? So
vaccine mandates depends on how you look at it, right? On the one hand, the government has a responsibility to protect everybody, right? So what the Presidential Steering Committee has said is, you can take a decision not to get the vaccine, but you do not have the right to infect others. There are people who have, they have vulnerabilities such as hypertension, diabetic. If they contract the COVID-19 virus, they're likely to die. And these people are in our offices. What the federal government is doing is protecting those who are vulnerable. And the federal government, in my interpretation, is not making this mandatory. What the federal government is saying is that it's either you get the vaccine or you show evidence that you are not infected. I do not see that this is mandatory if you have been given these options. Besides,
but the cost of testing, because you will require to do these testings almost
then when
every
it
day.
becomes, actually every 72 hours, then it becomes a choice for you to make whether you are so averse to the vaccine, right, that you want to spend that kind of money every 72 hours just to prove that you're negative, or you want to go and get the vaccine for free. You not only protect yourself from severe disease and hospitalization, but you also protect those who you love. You also help in building herd immunity. So it's not just about the individual. You look at it at the population level, that you're also doing this for your family members, your friends, community members, because when you are protected, when you don't transmit the disease, then it means that you are also helping in making sure that those who are vulnerable amongst us are actually protected from COVID-19.
Given the tentative, that we are not very sure of the numbers, I mean, in terms of the population in Nigeria, there is talk of a census about to be maybe conducted this year or so. But do you have a clear idea as to the numbers that you need to vaccinate? I mean, the vulnerable group, those maybe above 18 upwards. Do you have the number? You have an idea of how many millions, which will guide you as to the progress you are making or not making?
Right. So what we've done is to look at the population figures, not only at the census figures, but in the Federal Ministry of Health and particularly the National Primary Healthcare Development Agency. We've used, geographic information systems, so GIS, GPS, to be able to make estimates of populations using satellites, right? So we're able to say, based on the population density, we can estimate very, very closely to the exact numbers. We have put this side by side with census numbers. This is what the GRI3 program, does. So we've been able to get very good approximations of what these populations are.
And we've how many millions?
We're looking at 112 million Nigerians that are targeted all across the country. So we're trying to vaccinate at least 70% of the eligible people. So it's not every Nigerian that's going to be vaccinated. We're looking at those that are 18 years and above.
And will that achieve the much talked about herd immunity? That
is exactly what the computations, the modeling shows, that if you're able to achieve up to 70% vaccination for the targeted age groups, that you will achieve herd immunity. But we also recognize that apart from the vaccination, there are people who have naturally, acquired protection against the disease when they fall sick. However, vaccination only helps to even improve the quality of that protection. Even after you've been infected, when you get vaccinated, it boosts your immunity so that you are able to fight the virus when you get infected.
Do you have a time frame within which you are hoping to achieve these numbers?
Yes, we're looking at vaccinating these eligible Nigerians by the end of 2022. But there is a caveat to that. At the current rate of vaccinations across the states, we're not going to be able to achieve vaccinating those numbers, the 112 million Nigerians by the end of 2022, right? So we have to ramp up our vaccination rate. So I'll give you the scenario. So we have states like Jigawa.
I've seen one of Jigawa.
Absolutely, Jigawa, Nasarawa State, exactly, that are vaccinating, over 30,000 people per day. Then compared to other states that are barely vaccinating 1,000 per day. For us to be able to reach that target of vaccinating the eligible Nigerians, we need every state on the average.
But are these figures reliable? I mean, because what is it that Jigawa is doing that is able to achieve these numbers?
Leadership money, right? So what the governor, for example, has done, right? After we launched the mass vaccination campaign, he also launched the mass vaccination campaign in Jigawa State. He called all of the local government chairmen, and this is the same thing that the Nasarawa State governor has done as well, right? So in those states where you've seen high performances, you've seen very strong leadership from the governors. We've seen governors of Ogun State, Lagos State, we've seen Kano State, we've seen Ekiti State. These governors called their local government chairmen and gave them targets and said, I expect that you will work with your health teams, go to the communities, do social mobilization, communicate very clearly that these vaccines are important to protect you against these diseases, right? But making sure that the health workers also have the vaccines and they have the logistics to reach the most difficult areas. Sometimes what health workers will do is just stay around the metropolis and do the vaccination. They don't get to the rural areas. But what we're seeing now is that the governors are charging the local government chairmen. So for those local government chairmen that are reaching, say, the daily vaccination rates based on their populations, they're able to reach weekly and monthly vaccination rates. You see the governors of Nasarawa, governors of Jigawa actually giving cash rewards to the local government chairman and actually, like giving them roll-up banners that shows that they're the best local government chairman, for that week.
But it's not only about vaccination.
Right.
I mean, the other protocols, the non-pharmaceutical,
right.
Simple use of face mask.
Right.
I believe when you are coming for this interview, you could count the number of people on one hand that you saw with masks here in Abuja, not to talk of the rural areas. Is there anything to be done, or is a battle that you've given up on?
No, we have not given up on the use of non-pharmaceutical interventions. These have to go hand in hand with the vaccination. Just because we're now vaccinating, that doesn't mean all bets are off and people can go around without mask. You also have to continue wearing the mask. Again,
but people are not wearing the mask. That's the point. People feel that, okay, it's got nothing to do with me. It's some elitist thing, and why should I spend 100 naira every day just to buy a mask? Well, when I can't eat.
Right. Well, we're very clear about the fact that you don't have to buy a mask every day. We're very clear about the fact that you can use, even just a handkerchief. What you need is a face covering. The problem there is that people do not feel a sense of vulnerability, right? Because people are not dying on the streets like we saw during the third wave in India. People feel, oh, well, COVID-19 is not for me. But the reality is that people are dying, right? We have seen many prominent Nigerians who have died because of COVID-19. This is where the media also is very, very important. Communicating very clearly that wearing the face mask not only protects you, but also protects your loved ones from transmitting the virus. It is, a piece of work that we have to continue doing. We have to continue educating Nigerians until they become aware of exactly what they need to do, understanding very clearly that this is a collective effort, and it's not a question of an elite or a non-elite. It's a question of us working together to make sure that we get ahead of this pandemic and begin to live our normal lives.
Are you hopeful that Nigeria and the third world generally wouldn't be the big cog in the wheel of progress towards achieving this? Because you enumerated the problem you had, no vaccines available to buy, and now probably not enough resources to buy those vaccines. So how will it be possible for Nigeria to get there within the time frame and not be a drag on other countries that have achieved huge percentage of the vaccinations and all these measures?
I can speak only, for Nigeria. I cannot speak for other developing countries. But one thing I know about Nigeria is that we may start slow, but at the end of the day, we're going to breast the tape ahead of other developing countries. The resources are actually available. President Muhammadu Buhari has made funds available for the procurement of vaccines, and we're in the process of finalizing all of the paperwork that will ensure that these vaccines arrive. We have procured over 40 million doses. About 40 million doses of the Johnson & Johnson vaccine, and we've started receiving some of those vaccines in batches. Because of our cooperation and our signing up to the COVAX facility, we're going to get adequate vaccines for our population. So the issue of scarcity of vaccines is now a thing of the past. Now we have adequate vaccines. We're looking for the arms to administer these vaccines. And I believe that by the time the states sort of ramp up their vaccination, we expect on the average that states should be able to hit around 15,000 to 20,000 minimum of vaccination per day. Now, if governors look at that as the North Star and charge their health teams to say, look, every day this is what you need to reach. Tell me what you need to do, and we will support you. The federal government has supported states with financial resources to make sure that they're able to do communication, they're able to pay for logistics, and even extra stipends for health workers. Some states that are doing very well have also added resources. But the great thing about all of this effort is that the focus is not just on COVID-19. Apart from COVID-19, we're also integrating with routine immunization or childhood vaccinations. We're also providing vitamin A. So looking also at the nutritional status of kids. So we're using the platform of this COVID-19 vaccination to add other health interventions so that it's not just a narrow-minded focus on COVID-19.
Actually, that's what I wanted to take you up on, that your work is not just about COVID-19 and vaccinations about it. What has happened to the other aspects of your work? Has it suffered when there is all this concentration on just one problem?
No, actually, we have not focused only on COVID-19. What we've done is we've multitasked. So there are still teams that continue to do their routine work. What we're just trying to do is now see how we can integrate all of the work that we're doing in COVID-19 with other work. So what we have rolled out is what we call the whole of family approach. So when somebody goes to the health facility, especially in the first and second phases, we've asked them to also get their blood pressure checked, also do screening for diabetes. So when they ask you questions that suggest, and your responses suggest that you may have symptoms of diabetic, then you are referred, right? So we're doing the best that we can to work with other stakeholders to see how we can also integrate all of the primary healthcare services, at least the most essential primary healthcare services, so that they don't suffer while health workers are actually giving these vaccinations against COVID-19 and other childhood immunizations.
There have been recent reports about polio, I mean the vaccine-derived cases, and many people are getting confused. They don't understand after we've just announced an exit from being polio-free now. What exactly is the situation and what has been done to address it?
So the outbreak of polio viruses that we're seeing as a result of circulating mutant polio viruses. They are not the wild type. We have been certified as being wild polio virus free since August of 2020. After so many decades of fighting, we finally got the job done.
So the problem is the wild polio, that one
is done. It's done. We finished that. No child in Nigeria is being paralyzed as a result of the wild polio virus. The circulating mutant polio virus is akin to what we're seeing with COVID-19. Viruses replicate, they mutate. So we started off with the Alpha, the Delta, the Omicron variants. Same thing with polio virus.
But the polio this one, virus can it also, the new one,
yes,
can it also paralyze?
Yes, it does cause paralysis. But most times the paralysis is more of a weakness, right? And a lot of time it resolves, right? It typically is a result of poor water and sanitation. So just like the cholera that we're seeing outbreaks of cholera because people are not, taking pipe-bomb water. People
which is not available.
Right. So people are maybe drinking water from streams. They're not boiling this water. Sometimes, there's poor environmental sanitation. People don't clean up their environment, and then there's poor personal hygiene. These types of issues around water and sanitation exacerbate cholera. It's the same thing with the circulating mutant polio viruses. These viruses exist in the environment, especially where routine immunization is poor.
So are you ramping up immunization to what are you doing?
Yes, exactly. So what we're doing, again, is working with our traditional leaders, because the traditional and religious leaders were very central towards our eradication of the wild polio viruses. We're engaging them again and saying we have to go back to the war front and make sure that people have a clear understanding of what's going on and that they make their children available to be vaccinated against the circulating mutant polio viruses. And we're beginning to see in a number of states that this is having the positive effect of getting more children vaccinated.
What about Lassa fever? I mean, I hear that in other places it's also eliminated, but here we are, it's still a yearly problem. It's a seasonal problem. When the season comes, lots of people die and very valuable lives are lost, including medical workers.
Right, so with Lassa fever, Lassa fever actually originated from Nigeria. So it is really predominantly a Nigerian problem. And this is something that we're working with the Nigerian Centers for Disease Control, our sister organization. We're supporting to see how there can be early diagnosis and treatment for people who contract Lassa fever. Again, this is another challenge with environmental sanitation, right? So the rat that transmits the Lassa fever, will usually come around those households that do not have good environmental sanitation. And once there's that contact between the rat, the Mastomys natalensis,
the one that
species.
in Hausa is called Jaba, the one with the pointed mouth.
Absolutely. Yeah. So when there's that contact with human, then the transmission continues. And when people end up in the health facilities, they get attended to by medical officers, health workers, and then those are the people that are likely to now contract the disease. And then, it takes a very, poor downturn. But of course, we have seen in the last few years, again, thanks to the efforts of the federal government, the Minister of Health, there are more centers that have been established to improve diagnosis, treatment. The drugs are now even more available. So we've made a lot of progress from where we are, but there's still a lot of work that needs to be done. I think what will now cap us, our efforts as successful is when we're able to develop a vaccine against Lassa fever. And there is a lot of work that is going on, within Nigeria and then globally to develop that Lassa fever vaccine, just like we've been able to develop one against Ebola.
Thank you very much, Dr. Faisal Shuaib, for coming to this program. At this point, viewers, we wrap up this edition of 30 Minutes. Thank you for watching.